Hereditary spherocytosis. It is the defect in the proteins that interact with the RBC membrane, skeletons, and the plasma membrane. The main most common defect is the ankyrin, followed by protein 3 and spectrin and pallidin. Protein 3 is also called anion transport protein. And what are the features of the RBC in the hereditary spherocytosis? In the peripheral smear, you will see small, round RBC with less surface area and no central pallor. So there is increased mean corpuscular hemoglobin concentrations, and there is premature removal by the spleen, and you will find clinically the splenomegaly. And on the laboratory finding, you will find decreased mean fluorescence of the RBCs in the eosin 5-melaimide AMA binding test, and increased fragility in the osmotic fragility test. There is a normal to decrease mean corpuscular volume with abundance of the RBCs. What is the treatment of the choice? Treatment of choice is splenectomy. And what is the characteristic clinical presentation? Strikingly splenomegaly. And it is an extravascular hemolysis, not intravascular hemolysis. It is an extravascular hemolysis. And it is not an autoimmune hemolytic disease. So it is the Coombs negative hemolytic anemia. Symptoms is generally first when parvovirus B19 infect the person with hereditary spherocytosis. Parvovirus B19 is the smallest DNA virus that selectively infect erythroid precursors. So it induces the aplastic crisis in the patient with hereditary spherocytosis. So it will also ask that if there is increased osmotic fragility in the hereditary spherocytosis, then when we will find decreased osmotic fragility? Hemoglobinopathies with increased target cells such as sickle cell anemia, thalassemia, hemoglobin C are associated with decreased osmotic fragility. Okay, this is about hereditary spherocytosis.